I'm very rich. That's why I have all the little
There's
icons.
like icons.
Everybody has those icons.
I don't.
There's like you would have the icons if you looked at your phone. You don't go live.
I never go live on my phone.
I know.
What?
You can do the thing where you have the mask, like the raccoon mask. It's awesome. Try it later. We can't do a whole show with raccoon faces.
I think
Yes,
we
we
should do the
can.
next one like that.
Says the person not on the show today.
Well,
She's wearing one right now.
let's
She's
do
wearing
it to Madison tomorrow.
That would be awesome. All right, let's go, girl.
Okay.
Ready?
Welcome to the River Park Dental Show. This is Dr. Phing Saurer. Here with Michael Morris.
Thank you for that intro. No, it's okay. I just wait patiently for you to say that I'm here.
One day I'll get it right.
Well, I don't want to do the, I don't want to be like the Kathy Lee and Hoda where we just kind of step on each other where like you say your name and I go, and I'm Kathy Lee. Let's pour the wine.
Oh.
We should do some fake laughter.
Yeah.
People like fake laughter.
Uncomfortable laughter.
Well, we've been doing that before the show. Yeah, that, oh God, that's what we're talking about. Great. Ping, I thought today, because we had this conversation last week after the show, where you literally got out of the captain's chair and said you'd like to start discussing implants, dental implants.
Yes, dental implants.
Let's just say implants for now. Everyone loves that topic. So the reason you said you want to discuss it is because you actually like doing that.
Yes,
right?
It is one of my favorite procedures.
Which I thought that was an odd thing to say.
Is it?
That's what you like? Like, you really love doing it. It's kind of like when...
Yeah, why not?
I don't know. That's why I think people should, if they need this... I've had a couple of family members that have had to have this done.
Yeah.
And, you know, they're between 65 and 70 years old. I didn't really understand everything that went into it because I know there's the... I'm going to say this wrong. The 4-part... There's... We're okay. Don't forget. Sorry, if you're listening, the Facebook Live just fell out of the hinge
From
there.
the sky.
Yeah, and Ping jumped a little bit. Let's talk about the different facets of dental implants. Like, number one, who is a prime candidate for that?
Well, if you're missing a tooth, and you have good bone, then yeah, then I can place implants.
But how would they...
In good health, you know, you don't. If you have diabetes and you're a smoker, then that increases the risk of it failing
Because of the gum
healing,
tissue?
the wound healing aspect of it. So with if you're a smoker, then you your blood vessels are a little bit more closed, so you're not getting the immune cells to go there to help heal the wound. With diabetes, you just have your wounds are slower to heal.
Does that matter which type you have? Type 1, type 2?
No,
diabetes,
I think
just
it's the
overall?
same. Yeah.
And it has a lot to do with your gum tissue and the ability to heal. Basically, that's what you're looking at. I mean, that's
bone. The bone is the most important thing. You need to have enough bone to put an implant in. So a lot of times, if you've waited too long, so if you've had a tooth extracted for whatever reason, you lose a tooth, that bone will resorb. So it will just there'll be less of it because there's not a tooth to hold it into place. So then you might have less bone if you wait years to get it done. But it's not impossible. It can happen. The rate of bone reduction varies between each person.
Doesn't it also vary by, I mean, at the time that you need an implant, typically, what's that age range? Is that...
You shouldn't do anything before 16. So anything after 16, I prefer more 18 when your bone is completely developed that you can place the implant.
And it just depends on that bone, like what causes it to wear down. Because my question would be, the people that I know that have had it have been in their 60s. Wouldn't your bone density be kind of weaker than it would be your 30s and 40s?
Yeah, so it depends too. If you're a female, your bone density is a little bit less, and racial too. So white women, yeah, I mean it's just the bone density is different. But I have a cone beam, so I can look at the density of the bone beforehand. I can plan things out.
Can you say that again? Because you said that really quick. Like
the cone beam X-ray, so it's a 3D X-ray. So then I can really have a 3D view of the bone, where the nerve is located, where to place them, the implant. And that's for multiple implants. For single implants, I still use that, but I don't need it quite as much. And the other thing people don't know is that with implants, it doesn't always have to be like the 2-stage. What you're kind of talking about, the stages. So when it first started, you would say, for example, you had a tooth that was cracked or was non-restorable, it couldn't be saved. If you had to take that tooth out, and then you would have to put bone graft and wait for that to completely heal, and then you have to go in 3 months later to place the implant, and then wait another 3 months for that to heal. And then once that's all healed, then you can place the abutment, which is the part that comes out of the implant that acts like kind of like the tooth, and you place a crown on top of that. So it was a very long process.
How long would the process that you just talked about?
6 to 8 months when it first started.
For one?
For one.
Okay.
Well, if you had multiple, it'd be the same. If you had multiple plays, it'd still be...
Right, but I'm just saying 6 to 8 months for this one procedure.
Right.
No matter whether it's 1 or 4, still that's a lot of time.
It's a long time to be missing a tooth, especially say if you had to have a front tooth taken out. So traditionally you would wait that amount of time, then you would wear an Essex retainer, which is basically kind of like a ortho retainer with a tooth in the missing spot that you would just wear. And that's not the most comfortable. It's hard to keep clean, and when you eat, you have to take it out so people will know you're missing a tooth. So aesthetics wise, that's very uncomfortable. But now the technology's improved quite a bit. So with surgery now, depending on the bone level, of course, and where the bone is located, I generally can place an implant the same day that I extract a tooth.
You mean in one sitting?
In one sitting. So you're cutting down the 3 months of healing really from that. And then in a lot of cases, especially if they're in the front tooth, so if you're missing that very front tooth, I can actually place a crown on that tooth, a temporary crown, while it heals up, so that you're not having to wear an Essex and you don't have to walk around with a missing tooth. Is
that common in most offices, or is that just something that you guys are able to do because you do have more technology versus the kind of, I don't want to say mom and pop dentist, but the dentist that's been around for 30 or 40 years, they're not going to invest as much in technology as you are?
No, and I will say not a lot of general dentists will place implants. So
that's all. Yeah, they do kind of farm that out, right?
Right. So that's sometimes they'll say, "Oh, we do implants," but it's not just implants. Involves the surgery aspect and also then placing a crown. So sometimes they may just only be placing the crown, or they, if they're a surgeon, they just might be only placing the implant. But I do the whole process. So from start to finish, I will do an extraction if necessary, place the implant, put a temporary crown. Now, I will take it out of occlusion so you're not biting on it, putting force on it so that it can heal properly. But then that reduces the amount of time that you're waiting to get the tooth in place so that you're not walking around. Like a lot of patients I have that are embarrassed. They're like, I don't want to walk around without a tooth. Because a lot of times it's seen as a status thing.
Right.
And people...
Well, it does stick out. I mean, if you see someone that's missing
a
tooth... Yeah,
if you're missing a tooth, you're like, oh, what happened?
Like a crooked smile is one thing, but like if you're missing a tooth, that's got to be hard for somebody to want to participate and be social. Because
I
it might
don't
not...
want to be missing tooth.
Well, I don't think any of us do.
I do have a dental implant, though.
Do you really?
Yeah.
What is that? What caused that?
It was congenitally missing. I never had a tooth there. So then when I had braces, they created space and placed an implant. So now that I have 28 teeth.
Versus,
minus the...
Remember we had the conversation about how many teeth that people were having in the green room?
In general, everyone has 32 teeth.
Yeah.
That's including the wisdom teeth, which are most of the time extracted.
And just to prove that you know about teeth, how many rows of teeth does a shark have? Because this was discussed in the green room.
I don't know. 2 or 3?
See? So I just wanted to point out...
I should go swimming in the ocean and go...
That's not how that works. You can just look it up in a book or on Google. I just wanted to point out...
Like an encyclopedia?
I just wanted to point out that we were having conversations beyond what we were just talking about to do dental implants, and this led us into a whole mess of topics that I think we should have left alone, and it went into shark teeth. But...
Yes. But what we left off is that, yes, implants...
Is that you have an implant yourself.
I have an implant myself, but then also in offices, we were talking about when we get placing implants. Yes, I do the surgery and I restore them. So if you just want to check to see, sometimes if someone says they do implants, and you just want to go to one place, you don't want to go to a surgeon in one place and a doctor at another place to get the crown, then that's something to really look at closely.
That also adds more time to it, right?
Yeah,
I mean, you're having the tooth extracted one place, and then you're going to another place to actually have the procedure.
Right, and then there's communication too. So, and then people have certain preferences for what implants they're using. So I use one specific kind, Keystone implants, which I love. So I know exactly what I place, and I can restore it appropriately. And then also I can train the gum tissue to heal the way I want it to heal. So there's a lot involved with it.
In that same visit, though.
Yeah.
I mean, so if somebody, I want to say this first. The question I have is, why would somebody wait if they're missing that tooth? Let's say a tooth had to be pulled or whatever it may be. They shouldn't wait, right? Because your teeth and gums are going to move, right?
Right. So, well, one, you'll start losing bone because teeth will help maintain the bone at that space. But then, two, the teeth next to it could move into that space or kind of like tilt into that space, or the top tooth can fall down into that space. So you don't want to wait too long, but I always say though, like, sometimes financial might be a reason why someone doesn't want to do it. Sometimes it's just the idea of having to go through surgery. That just will scare people, which I make my patients very comfortable, so you're not feeling anything. But still, it's those things that, that will stop people from getting it right away.
So when you are talking to somebody who's going to put it off and it's a financial decision, there's just no option. I mean, is there any way around that? Not that you lessen the cost of it, but to kind of break it up, because I know the two people that had it done that I know, they put it off because of the financial aspect of it. Like, I'm not going to expend that much money to replace one tooth in my mouth, but then as time went on, they were having issues chewing and eating and all that, so then they waited another 2 months. Is there a way around that?
Yeah, so we have a lot of different financial options in our office. Ellen, who is amazing with insurance and with payment options, is probably the best person to explain it for my office. But we never let financial get in the way of having you restore function and aesthetics. That should never be a reason, at least in our office.
That's what I wanted to hear you say, was there's no reason not to get it done, because
No.
you're going to cause yourself more damage in the long run if you don't treat this.
Right.
And this is not like a situation when I'm saying treat it, it's like you have gingivitis or something. This literally changes the formation of your mouth and your teeth if you don't get it done.
Yeah. And then a lot of times the traditional way too, I just have to say, is a lot of people would get bridges instead of an implant, which is a totally fine option. But the cost difference between, if you were doing a single implant, if you're missing one tooth and you're either to choose between a bridge or an implant, I would definitely go towards an implant. Just because then flossing is a lot easier. You're not, with a bridge, you're also preparing the two teeth next to that missing space to make room for crowns that are bridged together. That's why it's called a bridge. So but sometimes that's necessary. Maybe you do need crowns on those two adjacent teeth, and that is more cost effective. But I always tell them, just because you get a bridge doesn't mean you can't get an implant later. So if that's what works for you financially at that moment, that's perfectly fine. The way to fix that later is we would just not completely cut off that bridge. We would just cut the middle part and then put an implant then.
So it's not like an either or. It's not like you're stuck.
No, you're never
stuck. One can be a transition into the next.
Yeah, and I always want to make sure people know that. So it's not like a final decision once they say something. Like if they do something that's kind of transitional.
There's not a cost difference. I mean, it's not like if you get the bridge, it's not going to save you more money in the long run, because the cost of the implant is the cost of the implant.
If it's just a single tooth, they're about the same things.
Okay.
Yeah.
I was just wondering if there's somebody out there that's listening and they're thinking about doing it. And again, I think people, when it comes to your health, it seems to be people want to cut corners. They want to save money on that. But it's like we talked about last week, when people are getting, like, you're seeing men come in for Botox, or what we're calling Brotox.
Right.
They'll spend money on that because outwardly people see that. But their mouth, they're willing to cut corners and save money.
Right.
Which is, it's totally not the way you should look at it.
Yeah, exactly. And then I also do want to say, though, like, if someone doesn't mention implants and they only mention bridges, you want to kind of question, like, maybe they don't do implants, so they don't bring it up. So, like, that's my approach. That's why I take so many continuing education courses. It's so that I can give you the best options, and I say that plural because then you can know the pros and cons of each, and then choose what's best for you at that moment, and not just here's one option because that's all I know how to do.
Right.
And sorry, too bad. So I think it's important to have as many options as you can get, and then see what the benefits are for them.
In your continuing education or CE classes,
Yes,
we'll just skip.
Short.
It's just too long. Your CE courses, are you seeing in the last few years a lot of the technology coming into this to the implant side? It seems like there are more dentists out there that are marketing that they have this service, that they want to take on implants. I think we all know that if you're looking at implants and bridges, there's more money than just being a traditional dentist, right? So I'm seeing a lot of it, but I'm seeing people that are just getting into the field. You know what I mean? It's like,
sure.
Just now I learned how to do this, or I opened it, the back end of my business to do this. You really have to know what you're doing,
right,
to do this.
Yeah.
So you're taking these continuing education classes. Is technology a big factor in the future of implants?
Yeah, absolutely. So I had mentioned earlier the cone beam technology, which is just a 3D image of your jaw and bone and nerve. So, for example, if you need to get all your teeth taken out and you need to have implant-supported denture, that takes a little bit more planning because the implants have to be in the right position. They all have to be parallel to one another so that you can place a hybrid or an overdenture or whatever you need in there. And you want to make sure you're not getting into the nerve. So there's a lot of things that are involved with that. So there's software to help plan it. And then what I do in my office is also I print a surgical guide from my 3D printer so that there's no guessing.
I forgot about the 3D printer. That's a big deal.
Yeah, it is. So there's no guesswork when it's more complicated. I do a lot of pre-planning before the surgery so that you're in and out and it's done.
Let's take a break real quick, and then we're going to get back into this after the break, where we are going to discuss implants all day long, or with the last 10 minutes we got. You're listening to the River Park Dental Show. We'll be right back.
Are you just doodling?
Yes, I'm drawing butter.
Picture of a roller.
Yeah. This is what a cavity looks like. Okay. Why don't you bring us right back? You ready, Jim? Yeah.
Here we go.
Welcome back to the River Park Dental Show.
Doc, before we went to break, we were talking about implants. If you're just now listening, that's what we talked about the first 16 minutes. You can always go back and listen to this. And Ellen does share the show on all your social media platforms,
yes.
The River Park Dental Show.
Let's go back.
How could somebody see any more information about River Park Dental? This is where you like to do the website.
Website.
You do the plug.
Yeah.
Do the plug.
You can visit us at riverparkdental.com, or you can visit us in person at the Bridge Park location in Dublin, or call us at 614-689-8686.
So to get back into implants, so originally we started talking about what makes someone a candidate for these. So you were talking about bone density. Where do you look at with bone, if someone doesn't have a good bone density, is that where a bridge, you can also do a bridge, right? So it doesn't have to be just implants, but is that the only other option they have?
No, you could do removable denture. It kind of depends on what they want to. If they want something that is fixed, meaning that it's not something that comes in and out, then a bridge or an implant are probably what you would treatment plan.
But you can do that as well.
Yeah.
The only reason I'm saying that is I don't want people to think, well, I'm just going to skip past bridge and everything else and go right to implant because that's what she said.
No,
there are other options.
There are other options, and that's what I mean. Like it's whatever fits you at that moment in your life, for whatever reason, financial, fear, whatever it is that you have going on in your life at that moment, we will work around and make sure that we're giving you the best care.
What, in your experience, what do you think is the leading cause of this? This is just one tooth kind of, or one area has gone bad, and over time, that's where implants...
Like losing a tooth, or...
Yeah, because,
So implants were actually discovered by endodontists. So because they were finding teeth that had...
what does that word even mean?
Root canal specialists.
Oh, there you go.
Yeah. So, they would do root canals, and, maybe the root canal didn't work, and they would go back in, and they'd find out that the root was fractured. So they would have to extract the tooth, and then eventually that's how you evolved. But now it's not really a specialty, so really any dentist can do it. A general dentist, surgeon, periodontist. I don't know if endodontists do it quite as much. Prosthodontists can do it. The surgery.
The last two words that you said are
Prosthodontist.
very Jurassic Park.
These are all specialties that people spend extra.
Oh, you don't have to tell me. I'm on the radio. I know for sure. But yeah, you go ahead.
I don't know what else I was saying.
You said a lot of people can do that.
You said something about Jurassic Park.
Well, listen. Sometimes you say words and I'm like, that's not a thing. That can't be a thing.
I know.
When you get all technical, it's like one of my favorite things because then I can
get so excited.
You get so excited. I look out the window and I'm like, when is she going to be done so I can ask what that means? But these are people, they take specific functions or they have specific roles when it comes to teeth and the inside of your mouth and the root and all that.
Yeah.
But you're kind of the overseer of all this, right? So you know how to diagnose and how to treat, whereas these people might be more just diagnosing. These other names of...
Some general dentists, yes. Sometimes they can just diagnose and say, yes, that does need an implant. I'll send you to an oral surgeon. They can take the tooth out, place an implant, and then you come back and get the crown done with me. Which is fine. There's nothing wrong with that.
That's the traditional way to do it, right? Because most offices don't offer.
I would say a lot of people do that way. And then there are a lot of dentists that have taken the same kind of courses and really love the surgery as much as I do, and they place their own implants and then restore it. It just helps for me because then I know the whole story of what's happening. Because sometimes if you're just put in to do the surgery, that's fine. But I like to know what happens afterwards. Did that implant heal well? Was there any bone loss with it? How did the gum tissue heal? So that's something the general dentist would then have to deal with, or a prosthodontist or whoever places that crown. But I can deal with that because then I'm seeing that healing process and I can address it directly.
Do you think it's also because you want to be kind of like a control freak about somebody from day one until they leave the practice?
I want to be, yes.
Not in a bad, but there's not another way to say it.
I want to take care of them from start to finish.
But you want to be their primary caregiver.
I want to make sure that they're being taken care of because sometimes when you send them to a different office, I just never know what's going to happen, and that always does make me a little anxious because I do want them to be treated
There's
well.
nothing wrong with that. You took that the wrong way. I meant that in a good way. I would rather know from start to finish how it is, because it's got to be gratifying especially when you get a kid. You get a kid in there, and you see them from the time they're little to when they're graduating high school, and you know their whole history, but you know them as a person, right?
Yes.
So it's not just another case that you're working on. They're real people. They're real friends to you.
Right. And actually, that made me think, I don't know why I thought about mission trips, but that's probably the one thing that bothers me about, and it's not, I like going on mission trips, but then when I come back, I don't know what happens afterwards. Like, I don't get the follow-up care. I don't get to see.
But don't you also get that when you volunteer on Fridays? I mean, you're
I know.
not really seeing those people.
There's a need, and I do it because there's a need, but that's something that, does make me anxious because I don't know what the aftercare is. I can't provide the aftercare. And that's just as important as the care during.
How many times have you been on a mission trip?
A couple times.
And where have you gone? I know this. We're going to save this for a totally different show because this is all about you. Really, we're getting off topic, but I thought with the last couple of minutes, you just threw a wild card out there. So have you
But
ever?
I like local. I do like the local stuff though. So sometimes I think that is neglected a bit because it's just not that there's not more of a need outside, but I think.
Well, you can't treat everybody.
No.
So you got to treat, but you do want to see the result of your treatment. It is part of the code of what you do.
Yeah.
You're trying to see somebody who's in pain or needs treatment, and you want to see it through to the end.
Right.
That must be frustrating.
Yeah.
Especially on those Fridays.
Yeah.
Because somebody came
but
to you.
Sometimes I'll see them. Sometimes they'll know when I come back, so they'll wait and request me.
They will come back to the same place.
Yeah.
Oh, that's good.
Yeah. So they'll know I come back Friday afternoon, so they'll check to see when I'm coming back, and then if the mom or parent or child wants to, then they can request me to see me.
How many other dentists or dental people are there for these?
I'm there by myself, so you kind of just...
it's like a shift.
Yeah. So you just tell them when you're available, and then they will schedule patients for you.
Oh, that's awesome.
Yeah.
That's totally different than your mission work, I'm sure. There's probably not a shift.
No, there you're working with a bunch of dentists and you're working together. But I have to generally bring my staff, or they provide staff for me, and then I will work solo. No, I work solo now though.
That is true. It is nice. I will
say I do like group. Eventually, I'll have associates or other dentists working because it's nice to kind of talk about cases. But I get that
little shop talk.
No, but the more minds, the better. But I do have study clubs and stuff that I go to for that.
Nerd. Is there anything else you want to leave people with about implants? Any tips, or again, if someone needs that or they're curious if they need that, they can still call.
Yeah, they can call,
talk to you.
Come in, have a consult. We can give a free consult and just kind of at least explain the process and then the financial aspect if necessary. And yeah.
And then how can they reach you? Just one more time.
614-689-8686. One of these days I'm going to forget this number.
I do. My favorite is watching your eyes get bigger as you're like trying to come up with the phone number. They just widen out like 86.
Because I don't call my office.
I understand.
So it's a number I have to actually memorize.
I do feel like I'm putting you on the spot, but then it's also kind of fun for me because I'm like, is she going to pull through on this? And you always do, at least I think. That's going to be it for this week's show. Phing, why don't you sign us off?
Yeah, thank you, and we'll talk to you next week. Listen to you.
So you should have her give the website.